Hello world, I'm Del Hussein and this is the Wow Mind.
We underestimate our patients, first of all. We've been very hierarchical about what they can expect. We know best. This is what should happen. We've thought about it. But now we've seen that change. They are ready for change. They want change. And all we have to do is talk to them about this and implement it with them. So we've seen that. Even if you look at the ward rounds I've done over the years, say 4 or 5 years ago. So I use a beam system. It's like an iPad on wheels, which you connect with your smartphone or your computer, and you can travel around the hospital endlessly with your face that appears. I'm sure you've seen these telepresence systems. So I used that 5 years ago in the hospital, and people are really scared. What's this? Have we thought about this properly? And because I always felt I could work remotely. I don't need to be face to face. It's just expensive. The most expensive part of clinical work is face to face. As a consultant, I get paid a good salary. And people expect to be there, for example. What if I'm not there somewhere else? I can use my time more efficiently, right? So 5 years ago, I was using this, and there's a bit of pushback, people thinking about it. They weren't ready for change. During the pandemic, I used it again. Everyone was happy with it. Wow, what a great idea. Amazing. The patients loved it because they were seeing me as a consultant, not a registrar or a junior SHO or something. They were seeing me, and my name came up on the screen. I saw them, how are you? What can I do? You know what? We did a little review of that. They're very comfortable. They're happy. I was seeing them directly on a daily basis. So they were happy. They were content being seen by a consultant. The alternative is me not being there that day and them seeing a registrar, for example. Which it's not bad. They're still very good. They obviously want to see their consultant. So if you do that every day, for example, from your home, you're saving time. Patients are better. They're happier. But also, in the pandemic, they were happy being remote now. So that changed. The 5 years ago, they'd been uneasy, and the people around them would be uneasy. The whole system wouldn't work for them. Now everyone's saying, what a great idea. That was in that 5 years ago. It's just that we've now changed to accept this new way of thinking. So I think we're in a good place now. I think we're in a place where the door is open. It was firmly shut before, and now it's open to new ideas, new concepts, and taking innovation or technology into the clinical practice to translate it into outcomes. So that has changed. It's propelled. It's accelerated. I say it's catapulted all of us into a new science fiction area. Which we were talking about a little while ago, right? And actually, we are in the sci-fi area. Who would have thought this is what we'd be only 6 months ago? But we are. So I think things have moved on. Things have changed. But what we mustn't let go, of this opportunity that's there now. The door's open. How do we now push and drive hard? One of the things I'd love to do is actually, one of the things I talk about to many companies is how do you bring innovation into the heart of every individual working organization? How do you change their mind to become more digital literate, for example? So what does that look like? Now that we're ready for this, you've got to work hard to create workforce that's relevant for tomorrow, but today. And so that's the gap we have now. We're here. What does those solutions look like? And my view is we should be setting up digital academies of learning, incorporate that into people's job plans, give them time, etc. Within that to think, redesign, repurpose, and support them. But at the moment, we're just looking at outcomes. How many patients have you seen? What's the outcome like? How many more can you see? It's about a numbers game. Not really driving human behavior. How do you support people? One of the things I have a huge problem with, Dal, is that, say as a consultant, you're there being appointed. I was appointed here in 2007. I've been here 13 years now. But conceivably, I've got another 15 years or 20 years to go. It's like a 30-year cycle being consultant. If I was the CEO of a hospital or CEO of an organization, I'd say to my most precious person, which is the consultant, because they have the most value, at 5 years or 10 years, I'd bring them to my office and say, first of all, what I'd say to them is thank you for your hard work. You never get thanked for the hard work that you do, the extra hours you're putting in. You just do it endlessly. It's part of who you are. I thank them. Thank you very much for supporting our hospital, our community here in the East End, for example. It's great. How can we help you the next 5 years? What do you want to do now? How do you support your progression? Saying, and you might say, actually, I've got these great ideas. Fine, let's work with those. You need to spend time here and there. Let's create a job that's suitable for you now, because you've given 5-10 years of your life. What else can we encourage you to stay in the NHS, in the health system, and you'll feel empowered by it? And that conversation never happens to anybody, which is amazing. It's the most expensive part of the organisation. You're not looking after and protecting them for the next 20, 30 years and getting more out of them. Do you know what I mean?
I know,
it becomes
it's
much more efficient.
Is that the case everywhere in the world? Oh, right, okay.
Most places. I think the other private hospitals are slightly different, because obviously you're bringing income into the hospital, therefore you're more rewarded and you're more respected in that sense. Here, because it's a different public system, the onus isn't for them to nurture your careers. And if it was a bold CEO who's progressive, thinking about the future, that's what I would do. Because at the moment we're seeing people leave the profession, and more will leave because of the pandemic. There's no question. People retiring early, leaving, looking for new avenues. A lot of junior doctors are bailing out, going abroad, doing different things, becoming entrepreneurs. So unless you make that job much more valuable, then people won't be interested. They can go to other industries, as you've seen. I'll give you an example, right? So junior doctors sometimes are difficult to get into the hospital because there's not enough of them. You have a lack of some junior doctors, and sometimes you have a locums in place. People who come a short-term contract for a day, for a night, etc. And so there's always a struggle to get the doctors in, constantly recycle them from different parts, whether it's the UK or abroad. And so I used to be a program director for training in London, and also a lead for training here at the Royal London Hospital. And sometimes, Dale, we'd advertise a job. We need this kind of person, call it an SHO or core trainee or a registrar. This is the job plan, blah, blah. You're doing X amount of clinics, operating lists, on calls. It's just a general plan for any doctor, right? We've done for decades. Then you'd wait for the interviews. Some may not apply, you may get no application sometimes, or you get applications that are not fit enough to work. You may shortlist some people occasionally for interview. You go to interview, no one turns up, or the people that you've interviewed aren't suitable. Sometimes there's nobody appointed. You need someone tomorrow because that job's spare capacity. If you don't fill it, it goes to a locum, paying much more money, so it's not cost effective. So what I did, I said, okay, look, the problem we have is people aren't interested. Let me redesign a job. So I put out a job that said this was an innovation fellow. Same level. Work 3 days a week, clinical. 2 days I want you to do innovation. Work with the tech companies which I introduce you to, innovate, maybe the technology, but I want you to do something different. Yeah? And so it was created as a job with two parts to it, but combined. Within about 24, 48 hours, I had 400 applications.
Wow.
What it meant to me was this is what people want. This is the job that people are aspiring to. But yet we're not designing jobs around that. Yes? They want a bit more flexibility. They want to do different things in the context of that clinical job. And no one else is doing this at the moment. This was about 3 or 4 years ago I did this. Thinking we've got to change the way we think about these jobs. People aren't applying because it's not suitable. It's not their fault. It's your fault. You're not giving them what they want out of a post. Think differently. So this is what people need to do. Think, what is that future like? What are the current doctors interested in? And how do we create a post that would inspire them, bring them into hospital, and keep them here? Yeah? And that just takes a little bit of tinkering around, thinking differently. So can we have something different?
Because, I mean, within that profession, it's such an ancient profession. It's so established that they don't want to change.
Yep.
It's like a tankard, you know?
Yep.
But then we're also at that point where in the last 15, 20 years, technology's taken over the fourth industrial revolution, as we say. And the people at the top, they don't know this because they're still from a generation of kind of the way we've always done it.
Yeah, that's part of the problem.
And maybe, you know, what's kind of a little bit unusual with you is the fact that you've totally bought into this technology and you're pulling it. How have you navigated it? I mean, you put it into the curricular parts. How have you navigated it to get it through everyone so they can understand it? Because I think this isn't so much about the technology. It's not even so much about the profession. It's about communicating change and ideas to people who are well established in their beliefs.
It's a really good question. So look, first of all, it's being in positions of leadership. That's the first thing. Getting yourself where you are on the top table to make some differences. If you're not there, then you have no voice. So first thing is to get in those positions, whether it's associate dean at a medical school, whether it's a clinical leadership, whatever it is, because then you'll be listened to first and foremost, because you have the credibility. Secondly, it's challenging people. And I like challenge just because I think it's the right thing to do. Is that right? Are you doing it correctly? Can you do it differently? Can you do it better? Constantly asking those questions to people. And people find that uncomfortable. Yeah. But that's okay. I want people to be uncomfortable. I'm happy if they've done the right thing, but ask the right questions. So when we were introducing this new concept of curriculum, I said, this is what we need to do. By that time, I had the credibility of doing some digital work. They said, fine, what does it look like? This is what it looks like. This is my plan for the future. Okay. They said, fine, just do this. Because it came from me, from my experience and my credibility, and I pushed it through very quickly. I put this course together, and it was implemented into the medical school within 3 months. It takes 3 years to change one MCQ question in the exams, right? In 3 months, I introduced a new part of the curriculum. Very supportive leadership for that. This was 4 or 5 years ago. Then every year we were doing this course, people were saying, is it right? Is it good? They're kind of ignoring it. This year, they've said to me, how many more days do you want? Because it's relevant now. We're seeing that all the students are desperate for this kind of knowledge.
So time's catching up.
It's caught up.
Basically.
And so now they said, how many more days do you need? How much more can we give you? Students are desperate. So it was saying, I knew what the future was. I was pretty sure this is where we're heading towards. Thankfully, I was right. Thankfully, I predicted this. In fact, I had a conversation with, I work with Vodafone as the ambassador for 5G Connected Healthcare. And they were saying to me, Shafi, now that you've predicted the future, what's next for you? I said, okay, well, this is where I think it's interesting. It's more about implementation and making it stick, as I said before. So we're in that phase now. People are understanding it better. And I'm really happy now. It's just not me being crazy, which may have been a problem earlier. Now I'm saying, actually, we were right in our vision for that future of healthcare and education and the global impact we're going to have. And now it's just about keeping driving that to people and bringing the other 90% of people who weren't interested before, who are now showing interest in this new world. So with that in mind, I'm writing a book at the moment, Dale, around digital health and transformation. All the ideas I've been telling you about for the last half an hour or so, bring to a book, because there's one missing ingredient in all of this. There's nowhere we can get this information from. This is me talking to you, right? There's no one book that's giving you all the technology, the innovation, what's going on in the world. So I think it's my duty to bring that to the mass market. So I hope that book will come out, hopefully by December. It might be early New Year. I've been writing it for the last 6 months or so. So that's my kind of, I guess, what I think is necessary for people to understand all this concept I've just described. Because what it is, it's a new language.
Yeah.
Isn't it?
Yeah.
You're used to the language. I'm used to this language. Most people aren't used to language. And they're scared because they want to know about it. It's hard to get information from everywhere.
Yeah.
It's all in the internet. It's on blogs. It's on, journals. I bring it all together. So this is all I know. This is what I've been describing. This is the future that we're here now. This is the new language, new terms you need to understand. Here you are. Use that, then look further forward to learning more about those topics. So that's kind of what I'm doing at the moment.
Amazing. In terms of the technology that's out there now, what excites you? I mean, what are you looking at? Not just in the medical world, but I mean, you're involved with quite a lot of other technology outside as well. I mean, you chair tech events around the world, and in there you're going to be getting all kinds of things about, I don't know, the world we live in. Where do you see the future, the excitement? For example, when we look at automotive industry now, and people are talking, they're already trying to apply in Dubai driverless cars.
Yeah.
What do you see happening from that, from your tech, with your tech hat on?
So what I really like is all these other industries. We learn from many other industries in healthcare. It's important for us to understand the smart city concept, smart industry. So I always look at all the industries. Let's take the car industry with Tesla driving, this whole self-driving capability, which is amazing. It makes all the sense in the world. And in fact, I just got a Tesla only recently, and it's changed the way you think about car ownership, what it means. It's a computer on wheels, basically, right? It will save lives. There's no question when you put autopilot, etc. So you learn a lot about that. Then you say, okay, what if things go wrong? So they've had a couple of accidents where people have died. They've gone back, looking at the data, because the data's there, saying what was the error, how did it happen? So imagine that in healthcare now, being autonomous, being remote, doing something differently, making mistakes. What do we learn from Tesla from that perspective? How have they gone about looking at that data? Who owns that data, right? So it's teaching us already about healthcare in essence. We look at SpaceX. We look at Elon Musk, pushing spaceships into ISS, the moon next, and probably Mars very soon after. But what is that driving? It's driving remote work. How do we innovate? They put a 3D printer into the space station in 2017. And one of the astronauts broke his finger, for example. 3D printing device built a splint, carried on working in the space station. So imagine that remotely here, for example, in a remote area of Africa or some of the lower middle-income countries. You could think, what can we do there in the same way? So all that driving that future is helping us today in other areas. We just don't see it, but that's why I see it. So all these industries work in different ways. It's great learning experience. And that's why you need to be at the forefront, understanding what's going on. I was thinking, how do I implement that here? What can I do with that in healthcare? I was thinking, it's great device, great idea. How does healthcare benefit? And that's what I'm doing, constantly driving the thought process around these big industries that are driving amazing change in society, but saying, how does it reflect for us? How can we help a patient with this? Yeah. What does that look like?
Can I ask you, coming back a little bit onto healthcare and the Nightingale Hospital. Now, we're in this time, there's this pandemic going around the world. You've been at the forefront of the Nightingale Hospital. And from your perspective, coronavirus, it's affecting the world. But then when we look at the numbers, I'm kind of torn in this discussion a little, because on the one side I see numbers and figures going up, but then on the other side I hear stories of, well, that person was quite ill anyway, and it was almost like the straw that broke the camel's back. But they're vulnerable, and I guess because people are not going to hospitals now, or they're going less, and anything that seems to come into hospital seems to be said that it's corona related. What should we believe? How realistic is this as an illness? What should people do? Is it wearing a mask and wearing kind of hand gel? Is that enough? How long will it take? Sorry, I've got a million questions on this. How long do we see it'll be? Yeah. They're talking about a vaccine coming in April. Is that realistic, or is that pie in the sky? What are your thoughts? So COVID pandemic, of course, is real. I had a small part in the Nightingale. I was a surgical lead for that hospital. And that was built very quickly, as you know, as a response to the fact that we might need more ventilators and more space. So the pandemic is real. We've seen the first wave. We've seen a loss of almost 45,000, if not more, lives already, and a lot of sort of comorbidity that's arisen from it. At the moment, all that we're saying to patients is to adhere to policy. And that means really social distancing, keeping away as much as possible, using your masks as much as you possibly can, where you're in close relationship with other people, for example. And I guess, hand gels, things are all very good, keep good hand hygiene. They're the three things we've been saying since the beginning and still maintain the truth. They're still relevant. We've seen a second spike coming in now because of the fact that we've relaxed those rules slightly. Not everyone takes them seriously anyway, and that's partly because the communication from government to the public, I think that could be much better. I think it's been a failure because I think we could have had more buy-in from people. So I think that's been part of a problem, the mixed messages, the lack of communication, and so people are not quite sure how they should manage it. It is new, so people haven't been through this before. We're expecting a lot from the public as well. It's not easy to change your complete way of living and working and being not part of a community. So that's, part of it. But also, community haven't also sometimes helped themselves. So in terms of the future, there's no question this is going to be here for a while. We go through this constantly, where there'll be a spike over there, maybe in the north of England at the moment, somewhere else, be local regulations change. This is a constant part of our lives. That's not going to change. We have to accept it now for at least a year to 18 months until we get a vaccine. Talking about vaccines, look, you look at the quickest vaccine ever
produced was about 3.5, 4 years. Okay, that was pushing hard. This is a different concept because we've got the global community providing data, doing clinical trials very quickly. There's much more speed around.
Are they cooperating? I mean, the different countries of the world with the...
Yeah. So the World Health Organization has created a vaccine community, all the companies working together for the common aim. We've seen great studies here in Oxford, for example, and other places where they've rapidly recruiting patients to do trials. To be safe, it just takes time because you make sure that what you're giving at the end of the day is safe for patients, is effective. But I think within a year, we'll have the vaccine. I don't think it'll be this year, by 2020, end of December. It's too quick. I think probably maybe Q2, Q3 of next year, we're looking at towards the end of next year for a proper vaccine. So what does that mean for us? That's a year for us. We've got to cope with what we've got. We know we're going to have regular restrictions in place. We know we're going to have to compromise slightly. It's kind of an acceptance of that, of what we live with. So I think there'll be constant changes every few months. You've got to be aware. You've got to adhere to the policy and guidelines, and just, I guess, try to prevent you from affecting others. That's the key. So that most people won't be affected too much. Some people get a nasty flu-ish symptoms. Some people will have no symptoms. Others, of course, we know it's the elderly over the age of 70 or those over the 50 with comorbidities like diabetes and high blood pressure and all those kind of things who are much more affected and are higher risk. And also people in other vulnerable groups. So we know what it affects and who it affects. So if we know that, there's a way of managing it. And this is where public health comes in. So public health, at the moment, has been managed nationally at the moment, but actually what should be done is managed locally. And obviously we've seen the huge issues around test and trace. Right at the beginning, in March, everyone knew that test and trace and isolate was the key for any pandemic. What we haven't learned, Del, is from experiences from SARS, from Ebola virus and others from the year 2000, where people very quickly have mobilized, managed a situation. We didn't look to the Far East well enough. Taiwan, Singapore, Japan, China, how they managed it very quickly. What did they do? What did they put in place? Did we learn from that? We didn't learn quickly enough. Which immediately said, this is the way we manage it. And in fact, Tedros, who's the Dr. Tedros, who's the WHO Director General, I remember a tweet back in March, April. He just wrote one tweet: test, test, test. You've got to do this. And so if we'd create that system where we really were adhering to testing everybody, improving the capacity, ensuring that we managed local outbreaks, we'd be a much better place. We've failed to do that. And that we've done it, it's not effective anyway. So we've failed on a number of levels. It's not difficult to think about a pandemic. This is not new. Pandemics have happened in other countries. Yes, over the course of time. This is new to us. We haven't learned from other people's problems. So my real issue is this pandemic has shown me there is a global phenomenon, and therefore we really need to use the global community and learn from them, using what they've learned, what technology they might have implemented, what innovation they might have implemented, and say, okay, how do we replicate this? How do we learn from that? What we find is individual countries do their own thing. Okay, it takes a mockery out of the globe as a whole because we're all connected.
Yeah.
Yes? Yeah. People are travelling, so therefore you have to listen to other people, right? And we failed on that. Hopefully what will come out of it in the future is that, for example, when we get another pandemic, which will happen at some stage in the future, we learn from the last one. We know how the world needs to work better together, how to put controls and checks in places, have the tech ready, the PPE ready, whatever is required to manage it. We weren't ready, and we didn't manage it well either. There's two things that we failed on. So that's kind of my current understanding of the COVID. In terms of medication, look, there's a lot of clinical trials about therapies. We've seen President Donald Trump only last week being admitted to a hospital at the Walter Reed Centre and being thrown every cocktail of drug possible into mankind. There's good science behind this. Hydroxychloroquine will not work. All the studies have shown it's not effective once you're in hospital with COVID. Remdesivir is of some benefit. We've seen that in recent trials. But all of these cases are marginal benefits. We haven't seen anything that's going to really cure the disease. That's the first thing. There's no cure at the moment. And secondly, the medicines you have to be very careful with. And you have to try to be on a clinical trial with that medication, etc., so you get the maximum benefit, and the data can be used to incorporate into studies. So that's kind of where we are. There's no effective magic at the moment in terms of therapy. The magic is preventing the infection in the first place.
Yeah. I mean, what's been really interesting is, I think when we all came out and everybody was told to stay at home, was just how actually superficial and skin deep this whole structure that we live in is. You know, you kind of thought, really, we're having to stay in now because the world is not prepared for this. The systems were breaking down. You know, corporate organizations were struggling to do their business, and so many companies, I think you're absolutely right, with Zoom and Teams and those kind of things, they kind of have saved the day. What was once don't use that, we know it's there, but we don't need to use it because we want to see you, we want you in the office. Now, yeah, please use it, we're grateful to it. So the mindset has changed. But more importantly, few things that seemed to be relevant was the NHS. People really appreciated the NHS. Medical care workers, people who deliver things, food. People stopped shopping for crap, you know, and it became, and technology seemed really important, and bizarrely Netflix. So it seemed to be people have got 5 things, 6 things that maintain them in today's society, that is existence, and a lot of the other stuff is superficial. And in a way, what became really apparent is a lot of the other stuff, if we don't need it, when the chips are down, when things are good, do we really still need it?
That's a really good question.
And then there's a lot of, unfortunately, a lot of well-known brands that have gone out of business, retail brands, designer brands, who you couldn't imagine closing, and they've closed because people are saying, I don't need it.
Yeah.
You know?
And 2 things. One is the model of some businesses weren't disruptive enough. They weren't thinking about the future. Okay? Online, different access. Do you know what I mean? They weren't thinking about the business. Look, Primark, prime example, right? They had no online service whatsoever.
Yeah, none.
You think in 2020, how crazy was that decision?
Yeah.
They just closed. Yeah? So that wasn't right. So you think, actually, well, that's your problem. You should have realised this is the future. Amazon, you've got to compete with other companies, right? So that's the first thing. Some companies themselves, their business model wasn't correct. The other thing I've noticed over the last 6 months is people have now worked from home. They've had more time with their families, with their children, with their loved ones, and they now reflect more on the work-life balance. Before, they were driving to work, getting trains to work, wasting hours of a day. I think, actually, this is better. Why can't we do this for long term? Why wasn't I doing it before? A lot of people are reflecting. I think we'll change the habits and attitude to what's actually necessary, as you quite rightly said. What do we really need in life? What's going to keep us happy? And so that's what's changed, I think. I don't think people will go back to either. They say, actually, now I'm very happy. So I think a lot of people, in that sense, will change. Either their work patterns, the workflow, etc. Like Google have said to all their staff, they're not going back until next year to the office, the whole year. And all of the tech companies are following suit. So if they can say to their staff, actually, you can work from home for a year, that actually, the converse part of that, which is effective, is getting more time at home with their family, etc. It's changed the way they have their work-life balance.
Their focus,
And so that helps. So I think that is going to be where we stick with the kind of new ways of working. And I can't imagine anyone in the future saying, you have to come into work 9 to 5. I can't see that happening again. They'll say, yes, come in a day or 2 if you want. But if you want to work from home, I'm totally okay with that. Who would have thought a year ago we'd saying to people, you have to be there, right?
Yeah.
And if you're not there, you get sacked immediately, right? So, but now that actually you can work. And it's just understanding actually people can work differently. So I think that's been great, actually, as an outcome, despite the desperate problem with the pandemic, is we are now challenging who we are and what we do, how we work, how society copes and lives and breathes. We've changed, haven't we? I can't see myself going back. Look, my clinics, I used to have clinics at the hospital, etc. And years ago, I said, I want to work remotely. I said, this is not necessary. They didn't quite listen to me at the time. Now, at home, on my computer, I have my computer. I have my electronic health record of the patient details, all from the hospital, on my virtual desktop. I have a iPad, which is my video software. And basically, the patients will come in, I'll see them, I write all the notes, etc., manage them. That's done. So in my own home, 2.5 hours, I'm done. All the notes are updated, all the documents are ratified, or in the hospital, I don't need to be there. So even as a surgeon who you think need to be face to face all the time, we don't.
Yeah. So when you see this, it seems incredibly ghostly, and I know when I look at how people socialize now, that aspect has seemed to have disappeared. So I think, yes, people are family oriented, but I think the community side has kind of somewhat disappeared. So the areas I think is a bit I'm nervous about, and don't know how long it will be before that picks up again.
Yeah, so I think that's a really interesting point. So there's no question being cooped up in your home or having less contact isn't good for your mental health and well-being, and that's been shown already that mental health has been affected by COVID, because we are natural social animals. That's who we are. We have been for a long time, and now you've kind of stopped it in a flash, which is difficult. So, talk about kind of football events and social events. I get that, but people want to. This is about enjoyment. This is about social interaction, which has changed immeasurably. So, but at the same time, you asked earlier, is it necessary? What are the key things in life that we need? Is going to a sports event necessary for everybody? Does that help? Is that part of your 4 or 5 pillars of your life? It was extra, wasn't it? It was extra, additional stuff that we enjoyed. Yeah. We got used to it. So it's extra kind of bonus for us in that sense. So I think that is relevant. And I think we'll come back at some stage. Who knows what's going to look like in the future and how we're going to congregate together. As season ticket holder West Ham, of this year I don't plan on going at all because there's going to be no way of going this year. But the plus side, there's a positive, which is so many goals scored in the last few weeks. It's the excitement. We're seeing, 6-1 against Manchester United, 7-2 Liverpool lost last week. We're seeing great excitement. And maybe, actually, the pressure on the players with an audience is too great. They weren't playing properly, they weren't flowing, they weren't scoring, because we've never seen this before. So the positive for me is seeing better football, more goals, more action.
West Ham beat Leicester 3-0. That was quite impressive. Surprising.
But also it takes this whole concept of being at home. Remember going to, say, you're at Anfield, such a hostile environment for opposition to go there. That's your 12th man, they call it, right? And it's hard to ever beat Liverpool, for example, at Anfield. Almost impossible. Same with Old Trafford. These were places you go to and the crowd would get you. But now it's equalised everything. You can go to Old Trafford now as a team and take Manchester United, not as we've seen before. So that has changed. Is that a good thing? Actually, what you're making all the games much fairer. Before you're saying, you go to Liverpool, you know what, you're never going to win. Because the crowd.
Yeah, you wouldn't.
So is that fair? Or is it better now? So actually,
it's changing the game.
Have we got it wrong?
It's changing the game.
Because you want a balance of two teams, right?
Yeah.
To play equally as well and give an opportunity, not to be, playing in a really difficult environment. So, I think so. That's the positive I'll take. But I've enjoyed the last few weeks. It's great football, right?
I tell you what, though, I suppose, again, using technology, they're maintaining themselves because everything is online. Everything is through BT Sports or whatever. So, I guess the money is still going to them, but the crowds aren't there. The physical element isn't there.
But I take the analogy with Netflix. Look, Netflix and Amazon Prime, for example, have disrupted the whole of the cinema industry.
Yeah.
Before, you'd go and see films, you'd queue up. Because we remember the days you'd queue up outside the block to watch these blockbusters, etc. Yeah. And now we're seeing Cineworld only a few days ago shutting all their stores across America and Europe. But what we want as individuals, I talk about this a lot, is about immediacy. What we've become in 2020 are people that lack patience. You can't wait. What I mean by this, I often give this example in my talks. I call us the one-click generation. So you want to watch a film, you can't be asked to go to Cineworld or View Cinemas. It's immediately on your Netflix, one click. Yes, we can see immediately. If you want to get food, it's Just Eat or Deliveroo, and you want food within half an hour, 20 minutes. If that Deliveroo says to you the food is an hour away, you get so upset because you can't wait an hour for food. You want it immediately. You get upset when it's too long. Uber, taxis. If you order an Uber on your app and the app says it's 25 minutes away, you'll be physically sick because you want it 2 or 3 minutes. You want it immediately. Why? But where are the cars? What are people doing, right? Because we want that immediacy. And so That's what's driving change, is the fact that we have access to things immediately. It's what we want. So these sort of industries and things were never going to survive. Actually, all it's done now is hasten the demise almost. Yeah. So I think that is kind of how do we now change that conversation? These companies change their business models around this, and that's going to be the challenge for everybody. And for the audience, I'm sure they remember the Kodak moment. I'm sure you realised that. Yeah. Kodak, obviously, were the biggest photographic company in the world, and they didn't think about digital cameras, although they invented the digital camera. That was the first one. And so what happened was, because they were relying on 35mm film, people came in and they went bust because they weren't thinking about that future. And then people talk about actually where people can lose their jobs. A lot of people lost their jobs. Well, actually, my view about jobs is different. We repurpose ourselves. When that happened, that Kodak moment, there was employees, people who are doing the film, for example, who are doing the photos, who are in the darkroom producing the prints, all those kind of. We went to Boots, you gave a film in, they came back with 30 prints. What do? They repurposed. They became designers, people working on digital cameras, working in different. They changed their jobs to support the new industry. Okay, they didn't go out of business. Now we've got more people involved in the photographic industry than ever was before. So people say, "Oh, you lose your job." No.
It's really interesting.
Human beings will repurpose. We are good at repurposing. There's always been jobs disappearing. There's always been industries that have been carved out. Right? We've just repurposed. We've rethought what do we need to do next, and we'll drive that. So I'm not as worried as people are, because the society will decide where the next jobs will come from. There was a great article I was reading a while ago that's saying 80% of the jobs in the future haven't been invented yet.
Yeah.
We don't know what they are. We have no idea what's needed in the next 5 or 10 years. Yeah. So that's I think the positive thing to come out of it. Actually, we're in a position we can redesign jobs, flexibility, how people work in the future. That's an opportunity for me, I think, rather than being, of course, it's depressing when people lose their jobs and people being furloughed. I get that. But how do we move on?
Yeah. It's fascinating, actually, because I think you're right with the idea of new jobs, repurposing new roles. I mean, part of this whole pandemic's taught people that because they're doing so many meetings in Zoom, that there's a new industry opened about creating Zoom backgrounds. Just little things absolutely. Like that. Yeah. And I was talking with somebody the other day who was saying, we've just written a course on online etiquette.
Yeah, absolutely. Yeah. Comes out of the blue.
Yeah. And you kind of think, well, yeah, maybe it should be. It's kind of training, and particularly if they're networking through online as well. There's a whole new science about the psychological engagement of people when they're online with other people. What are they getting from it? What do they see? How authentic is it? What are the movements? Every little nook and cranny. There's
a whole master's for you to develop at UCL, or a whole module around
Got an idea.
This. Yeah. And I tweeted yesterday. I said basically it's been 6 months of Zoom type conferences, and the most important 4 words that will be left as a legacy for 2020 is your mic is off. Right? You're muted, right? Yeah. And those are the words we remember forever now, because they've changed, as you say, the way we think, right?
Yeah.
Can I hear you? Can I see you? Can you hear me? Can you see me?
Yeah.
It's the new language of telemedicine or Zoom calls. But again, as you say, industry 5.0, not 4.0, no, we're on 5.0, is going to be the new way of working.
Yeah.
And I think all the stuff we've learned from the pandemic, the way we're working, the way we behave, what future work will be available to us is Industry 5.0 now. So, and that's come at a pace which we weren't expecting 6 months ago. But like, human beings are resourceful. We've always been resourceful. We think, we challenge, we redesign when we're faced to. We've always done that. I just think we repurpose everything. It'll be a different world we live in. Yeah. We almost don't know what it's going to look like. And I'll leave you with the last quote from Abraham Lincoln, which I often use in my talks. Basically, it talks about the future. And the future is up to us, because we create that future. Okay? So the onus is on us. Future is going to come to us. We create that future for ourselves. And that's what the opportunity is here today with the pandemic.
Fantastic. Shafi, with that note, perfectly timed, I don't know if anyone can see this, in the back of the scooter. Shafi came on this, and I thought, yeah, that's just typical.
Well, I was avoiding, if you're trying to do social distancing, these are great.
Yeah.
You don't have to be on a crowded bus. It's really easy to get around. Hopefully they'll become legal fairly soon. They're going through the framework now. So it makes sense. It's a new way of, and also it's electric. You're not ruining the atmosphere with pollution. And it's easy to manage. So yeah.
Brilliant. Shafi, thank you so much.
Pleasure.
Really
Really
appreciate
good.
it.